Hello, welcome to the inaugural Autoimmune Summit. This session is Policies Impacting Autoimmune Patients. My name is Brett McReynolds, and I'm the Vice President of Policy here at the Autoimmune Association. There are many policy areas we focus on here at the Autoimmune Association, but today I wanted to talk specifically about the barriers patients face when trying to do what should be a simple thing, access their clinician prescribed treatment for their condition. First, I'd like to set the stage with a short video from Let My Doctors Decide. This is a campaign here at the Autoimmune Association that brings together both patient and provider groups to talk about these barriers. So if the producers could please bring up the video, we'll watch that now and go from there.
There's no other way to say it. Our nation's healthcare system is complex and confusing. Worse, patients aren't able to access the treatments their doctors prescribe. That's because health insurers and pharmacy benefit managers yield immense power and control when it comes to deciding what treatments and services patients can access. And they make these decisions by putting profits, not patients, first. Today, there is increasing need to bring attention to and remove health insurance barriers that prevent patients from accessing doctor-prescribed healthcare treatments and services. The list of barriers that patients and providers face is growing daily. These include step therapy, prior authorization, rebate walls, non-medical switching, high-deductible health plans, denying pharmacy of choice, copay accumulators, not sharing discounts, complex appeals process, coinsurance, and copays. We must eliminate these barriers if we are to put decision-making back where it belongs, in the hands of doctors and patients. Visit letmydoctorsdecide.org to learn more.
Thank you. With our new campaign here focused on these top 10 barriers to access and care, we're targeting key stakeholder groups and decision makers, not only to educate, but to drive patient-centered policies to create meaningful change. I encourage you to visit the website, letmydoctorsdecide.org, to learn more about these barriers, and you can tell your story there. But one I would like to highlight today is step therapy. Many of you have probably gone through this. Some of you have gone through it and not even known you were going through something. And so I just wanted to sort of define that here, and then I will turn it over to Brooke and Amber to talk a bit more. But this particular process, step therapy, or tactic, as I like to call it, by insurance companies, was first introduced by managed care organizations in the 1980s to control cost. So you may have heard of this in a different way. It's also called fail first. Under these programs, you may need to fail on a drug that the insurance company prefers before getting to the drug that your doctor prescribed. As I just mentioned, I know many have probably been through this and could tell their stories. And I know that some are dealing with lifelong health issues because of onerous step therapy protocols. It's time to bring the decision-making back to the patient and the provider. These onerous protocols and tactics by insurance companies cause harm. They limit the doctor's decision-making, and they waste millions of dollars. But most importantly, it harms patients. So you can raise your voice to end these onerous practices. One way you can do it is by asking your members of Congress to support the Safe Step Act at a federal level. And then you can get involved in your state to find out what your local step therapy laws are locally. But without further ado, I'd like to turn it over to two individuals that can talk a bit more about their patient advocacy experience and give you tips to best advocate for policies that impact you. So I'll turn it over to you, Brooke and Amber. Thanks.
Thank you so much, Brett. Appreciate that. Hello, everyone. Good morning in the West and good afternoon in the East. We are the IBD Moms. I'm Brooke Amber. I'm Brooke Abbott. And I am joined by my very good friend and co-founder, the better half of IBD Moms, Amber Tresca. We are an advocacy group that focuses on moms affected by inflammatory bowel disease, either as patients or caregivers. And we are hyper focused in the legislative space. So today we're going to talk with you to kind of break down some myths and a little bit of confusion that you may have about advocating in the legislative space. And hopefully we can encourage you to join us on the Hill.
Right, exactly. Like Brooke said, we are the IBD moms, and we want to talk to you today about becoming a healthcare activist. And I would say actually that just by being here today and participating, you're already a healthcare activist. So number one, done. So moving on, you don't need to be a policy expert. I think that's one of the biggest things that sort of stops people from getting started in the advocacy space, is worried that you need to have a background in law or something like that, which I don't, so you don't either. You do not need to be a policy expert. What's important is your voice and your story, because that is what helps get legislation passed that impacts all of us and improves our quality of life. And through the tips and tricks that we're going to teach you today, you can get started right now. After you're finished with this conference today, you can get started, and we're going to give you some ideas on how you can do that.
So one way that you can advocate is by letter writing. There's three different ways. There's postcards, there's letters, there's emails. Postcards are pretty specific. It's more of like a call to action. It's a quick, support this bill, support this piece of legislation or this action. And usually you have like a large group of people on social media getting together, writing postcards together and flooding offices with them. Letters are more personal. That's where you can tell your story and give a more in-depth idea of what it's like for your day-to-day or for the patient that you give for their day-to-day. And then an email is something that you usually use if you have direct contact with a representative or a staff member. That's something that you utilize to keep in communication, making sure that the piece of legislation that you have asked about is actually going to get through committee, going to get voted for, where it's at in the process. And one thing I will say about emailing, it actually works. I'll tell you a brief story. My kid, when he was about 6 years old, 5 or 6 years old, wanted to write a letter to the United States Senator that we had at the time, Barbara Boxer. I happened to be going to Washington, D.C. He wrote his letter. I asked for the health policy person that I spoke with. I asked for her email. I was following up with her. And then I included my son's email or letter in the email. And that actually sparked off a really sweet email pen pal relationship that Jax ended up having with Senator Boxer for the remainder of her time in the Senate. So they do read them. They are very receptive to letters, postcards, and emails. And most often people use those postcards as evidence to push a vote.
That's right. I think, Brooke, maybe we should take one of the pictures of Jackson and Senator Boxer and put it up on the app.
We should.
Because there's some really cute pictures of the two of them together. They were quite the little advocacy duo.
They were.
Yeah. So one thing that I will say is that we tend to talk about specific bills. And so when you are writing a letter or you're talking with someone, a lot of times they will ask you for that bill number. So it's important, if you can have that available, that you can reference it. And we have a handout actually up on the app at the IBD Moms space that tells you where you can find those numbers and where you can track those bills. So another thing that you can do is you can make phone calls. I will say that it is helpful to sort of prep a little bit before you make a phone call, prepare what you're going to say, have that bill number in front of you. Something that's also helpful to do and important is to identify yourself as a constituent. And what I mean by that is that you live in the district for which the representative that you're calling represents, so that they know that you live in their district and you care about what's going on there. And that's why you're calling them to discuss a piece of legislation. It's important to be brief and to the point. The person answering the phone will be a staff member. Sometimes they're a junior staff member. So it's important to be polite and to be very clear about what it is that you're advocating for, and to thank them at the end of the call.
It's also important to remember that the people answering the phone are lower staffers. Quite often they are interns. They may be as young as 16 or 17 years old, and as old as 22. It might be their first job. And sorry, my dog is trying to get out to speak to you guys about advocacy work. It's important to remember that they are people, and that their job, their one job, is to take your phone call, write down all the information that you give to them, and give that to their boss, who is a higher staff member. We've been in the office when they've taken the calls. I know that they take the calls. So just remember that they're getting about at least 100 calls a day, and it could be on a variety of issues. But when there are hot topics, that's when the calls start flooding in, and they do record those calls. Those calls are important, but just remember, it might be a kid that you're talking to.
who is doing a phenomenal job and loves their work, but they are very busy answering those phones, that's for sure.
So setting up a meeting can seem a little bit intimidating, right? Usually when you go with a advocacy group, they set up the meeting for you, but it's actually very easy to set up your own meeting. What you can do is you go to your representative's webpage, and you'll find numbers and emails for their Washington office and then their local offices. Call their Washington office, say that you would like to meet about this health issue, and ask to speak to the you want to meet with the health policy person. You want to identify yourself as a constituent. You want to talk about the specific ask that you have, whether it's a specific bill or an issue. And then you want to ask if there's any local town halls or anything like that for an upcoming event. You can always go to those and ask questions, and that's a really good opportunity to be able to meet your representative and meet some of their staff members and start creating those advocacy relationships with that staff person.
Right, so that's local, and then there's also federal, which getting in touch with them is largely the same. I will say that one of the ways that Brooke and I have participated and find very helpful is to work with patient advocacy groups and attend their Hill Day. And we think right now we've been doing things virtual for the past 16, 18 months. So we've done, I don't know, Brooke, maybe 2, 3, 4 different Hill Days virtually. So those go really well, actually. And we're not sure how long it's going to continue. It does seem that it lowers a lot of the barriers because we don't have to travel, which of course we love to do. We love to go to the Capitol, but it does open it up to folks who may not be able to travel down to DC for one reason or another. So this is a really great time to get involved, do those Hill Days, and learn how to start taking these meetings and how they go. If you do go in person or even virtually, you make sure that you have your asks, so you know what it is that you are advocating for that day. And if you're working with an advocacy group, they will let you know. You will get some training and you will understand what their healthcare policy is, and you will bring those to the staffer that you're talking to. But once again, you do not have to be a policy expert. What's important is that you tell your story, because your story is likely going to relate to the legislation that you are discussing with them that day. It's at the end of an in-person meeting, it's usually pretty easy. You just ask for the staffer's card, and then you have it, and then you're all set. Virtually, you have to still remember to ask. I'm not saying I'm perfect at that, but you still have to remember to ask, and then maybe get their email. Sometimes if you're doing it virtually, they can put it in the chat or something like that. You can get their email, because following up is always an important thing to do after these meetings, no matter how you meet with folks.
Absolutely. And if you guys have any questions, please feel free to put them in the Q&A, and we will do our best to get at them. So going into following up, this kind of goes back to my story about Jackson, Senator Boxer. Jackson's relationship at one point with Senator Boxer helped us to get her to pay attention to some of the advocacy asks that we were hoping to have. You want to keep those business cards. You want to email and check in at least once a month just to see where the bill's going. And you want to congratulate them and thank them on legislation that has passed. You want to keep them up to date with your own story as your disease evolves, or as your condition, or maybe perhaps something that has to do with the bill has actually helped you, or it's hindered you, or not having it pass has hindered you. You want to make sure that they know that you are a real person with a real issue, and that this bill is going to impact your life completely. So just communicate, communicate, communicate. Don't feel like you're, hounding people. They get emails all the time, and it's important. They actually want you to keep in touch with them because they want to be able to bring this up to the representative and make sure that the representative keeps that that piece of policy up high on their agenda.
Right. And the back and forth can be really helpful. I've had it happen where the staff member will email me and say, guess what? We had a meeting this morning and we're talking about this. And my boss is thinking more about this bill. And sometimes I might have questions. I'm not saying that I can always answer their questions, but I can usually go back to, for instance, one of the patient advocacy groups and find out more, and then get an answer to some of the questions that they might have about the bill. Or, if we know another patient that maybe couldn't come to a meeting for whatever reason, we can share their story. If they want to, write it down or give it to us in some way, we can share that story through email. Another thing that sometimes happens is that legislators will want to illustrate a patient's story, especially if they are sponsoring a bill, or they're getting on board with a bill and it's coming up for a vote, something like that. So they may reach out to you and say, I'd love to share your story, or do you know any patients that have experienced, some other issue that I can illustrate and that we can bring forth. And that's what really helps, is because it's the bills are important, but they're important because it's going to impact us, personally and as a patient community. And so that's why the storytelling is so key and so critical. And it's a big part of what we do.
Absolutely, absolutely. I also think, if you're able to, or if you feel like you're not ready yet, writing a letter first and associating yourself with an advocacy group first kind of is like, that'll help you get your feet wet. And you can always go to our website. There's a spot where you can put your story in, and we will send those off to Congress ourselves. And then we'll follow up with you and see if you're ready to actually tell your story yourself.
Right. Yeah. And pictures sometimes help too. If you're talking, if we're explaining a story that's not our own story, but which we have been given consent to share, a picture sometimes will also be helpful.
And Christmas cards. Christmas cards are big.
So some tips on being more effective. Something that I have found has been really helpful, both in activism and then also just as a person, as a constituent, is learning about my representatives. So I sign up for their emails, and they send them every so often, whether it's once a month. Through the pandemic, there was a lot of them during lockdown. It was like every day I was getting an email from like 2 senators and then my congressman. But they're really informative, because you don't always hear about all the things that are going on in your local area or in your state, but they know those things. And so you'll get them in the emails, and then you can learn about, I don't know, it can be fun stuff, it can be important stuff, whatever it is. It just helps you stay in touch and learn what's going on the ground. You can also follow a lot, if not all, of the people that represent you on social media. And what's important about that is, again, you can find out about things like town halls. So your local representatives might have things like coffee meetups, things like that. It's going to, it's going to be scattered here and there, especially, while we're still dealing with public health emergency, but they will tell you where they're going to be and when. And then if you can show up and have a conversation. And that's really a great thing to do. Another thing is that then you can learn about what the issues are that are important to them. For instance, one of my senators, veterans issues is very important to him. And inflammatory bowel disease and digestive disease is an issue that does affect veterans. And so when I'm speaking with his staff members, or I'm going to his office or whatever, I will bring that up, that is important. And that's, a way for us to connect on a level that is important to me. It's important to him, and we all get along. I will say too, that it's important. It's practicing telling your story is a great thing to do. It's a little weird, but maybe in front of the mirror, or if you feel like recording yourself telling your story, or if you want to try it out with a friend, if you go
I do.
you record yourself?
I record myself, and I practice in front of Winston. He's a terrible audience member, but it helps because he is so terrible. Winston's my dog.
So if he sits and pays attention, do you know that you're doing it right?
I know
is
that
how
I'm
that
like,
works?
the pitch is good and the speed is good, but if he's sitting there and he's like snoring or he's rolled over, I've lost him. I'm done. I'm toast.
And this is where getting involved with your patient advocacy groups can help as well, because the Hill Days that Brooke and I have attended, either separately or together, there will be some training, and then there's another person there who's going to tell their story, right? And they can tell you their story, and you can tell them your story, and then you share tips. And if you're going into meetings together, you can sort of decide, okay, I'm going to hit on this point, you're going to hit on that point, and you can work together. This also works virtually if you're doing virtual meetings. I think the virtual meetings, we've also all those of us that are taking the meetings together, we just sort of come up with a time and get on a call and talk and decide how we're going to handle it. So however you can practice, however you like to practice. I'm a person that likes to write things, so I write things out. I might have note cards, totally fine. But it does help because you want to be succinct, you want to hit on the right points, and you usually have it could be 5 minutes, it could be 20 minutes to have a meeting, but you need to get in all of your points. And then you want to make sure, if you're advocating with other people, that they're also getting their chance to speak.
And two things I'll add. You can create an alert for your representatives on congress.gov. So whenever they vote on something or they sponsor something or co-sponsor something, it comes to your email and you know where their legislative agenda is going for that Congress. So it kind of helps you gauge like what you're stepping into and how you can kind of bring your political or your legislative ask into the actual meeting. And then also, when you have these meetings and you're on Capitol Hill, sometimes they're on the fly. There have been times when I've had meetings in the breezeway between, the House office buildings and the Capitol. I've had meetings in the hallway. I've run into people in the elevator, and we've had a discussion that's led into the office, but has started on an elevator. And then there have been times when we had a senator one time, she was going to committee and she literally said, I have 5 minutes. And so we decided that the person with the most impactful story would tell their story very, very briefly, and then someone else would come in with the policy and we tie it together. And it actually worked very well in our favor. So that's why when you're advocating with someone, it's important, or with a group, it's important to practice and make sure that you guys are, going quick and hitting those points right, because things move very, very fast in Washington. So you've got to move fast, you got to be flexible and roll with the punches. And I know some people are like, oh my gosh, they wouldn't, they only met with me in the hallway. And it's like, they met with you, and I'm okay with those meetings because I know that instead of brushing me off or just canceling it altogether, knowing that I'm only there for that day. They make the time to walk with me and listen, and a staff member is writing it all down and getting it all down, and we'll go back to the office and make sure that it's recorded and everything. So meetings anywhere are important. Any meeting is an important meeting.
Yeah, the hallway meeting, the first time it happened to me in the Capitol, was a little, it made me a little nervous. I didn't know quite how to respond to that because I was used to coming into the office, and sometimes you're meeting in an open area space. Sometimes they have a conference room space for you, but essentially you do just need to be flexible and be ready to sort of get down to business no matter what, no matter what that meeting ends up
Yeah.
looking like, and
Yeah.
making that connection with the staff member. After being there in person several times over the years, and then being on the phone this past year and a half, you know, I've made connections. Brooke, you talked about how you made you know, connections with your senator's office, and you know, I've made those connections too. And so sometimes it's kind of funny to show up and say, well, hi, I'm here again, you know, but you know, they do remember you, they remember your face, they remember what you were there last time to talk about. And I want to talk for a minute too, Brooke, about the congressional sessions, because that was also something that I wasn't really too aware of.
Yeah.
Is that the bills need to be reintroduced again every session.
Yes, and that's at the top of the year. So you have until January 3rd, I think. I can't remember the exact day, but you have until the beginning of the year, until the end of the year, to get that bill all the way through to the president. And in some cases, that has happened in emergency situations, but for the most part, you know, you have a bill that's going to go multiple sessions. It's going to get reintroduced, get co-sponsors and sponsors until it finally gets enough to go through committee, to go to, you know, go through the entire thing till it finally gets to the president. It is very rare that you will have a bill that starts off at the beginning of Congress and ends Congress with a signature with the president. It's just, there's just so much to do. You know, we live in a democracy. We have to govern every little thing. They have to, you know, begin the start of their holidays or our holidays, or you know, opening a post office with a vote. Everything is a vote, and those votes have procedural votes. They have to vote to vote. So, you know, there's a lot going on. So again, you know, governing and politics, it's all a marathon. And you just have to be patient and flexible. But that's why, you know, when you get started on a piece of legislation, you've got to be committed to it, because you may have to see it through for the next 2 to 3, 5, 6 years.
Mhm. Yeah, let's talk for a minute too about sponsoring and co-sponsoring, because that was something that I don't think that I quite understood. So one of the things too, that when you are bringing a piece of legislation in front of your legislators and you're telling them, hey, this is something that is really important to us, to our patient group, and we're going to ask you to co-sponsor it. Like, what does that mean, Brooke, co-sponsoring?
So co-sponsor is just basically you're showing your support. So you have one or two, it's usually like one senator who, or one representative who sponsors it. That's their bill. They draft the bill, you know, and then they go and they knock on, you know, someone else's door. So you've got Senator Murphy, and he's got this really great bill, and he's like, he goes down the hall and you know, he knocks on Senator Blumenthal's office, and he's like, hey, we're senators from the same state. Let's work together on this. So Blumenthal's like, yeah, I'm going to co-sponsor this with you. I'm going to support you. And I'm showing you that I am supporting this bill. And I'm going to do everything I can to vocally do that. I can bring in other co-sponsors. So you have to have all of these co-sponsors, all of this support in order for it to go to committee.
Yeah, I think that was really confusing to me. I didn't quite understand that. And then I want to talk for a minute too about not getting discouraged, honestly, because you and I have been working on, I think, some of the same pieces of legislation for quite a while. And
yes, spider webs.
it does feel like, okay, we're here again, and here we're working on this bill, and now it's a new session. So, we're starting over again. So, you know, how do we not get discouraged? Because that was a surprising thing to me, that I would be bringing, for instance, step therapy. I don't know how many years we've been advocating for this.
Step therapy. Yeah, it's been quite a long time. I think it's important to go back and look at history, and I mean actual history of big pieces of legislation that got passed. When we think about amendments to the Constitution during a time that was, super hostile in Congress, and the nation was completely divided on social issues. When I think of, this, I think of Martin Luther King and the Civil Rights and the Voting Rights Act, going to Washington every single day for weeks, sitting outside of the Oval, sitting next to Ralph Abernathy and CT Vivian, and waiting for Lyndon Johnson to say, okay, come inside. I mean, literally waiting. And then, Lyndon Johnson going to Congress and having the courage to say, I know that, most of the people in this legislative body are against both of these bills, but I'm going to do it anyway. The Civil Rights Act was not one and done in the 60s. You had a senator who had a daughter of color who stood up for almost 26 hours, filibustering that particular bill in the 1950s. So it's a long time. That's when you really think about a chunk of time, that's 10, 15 years before it was actually passed. But once it was passed, then then it's moving on to the next thing. When you think about healthcare and actually being able to have patient protections, how long has it been? We think about all the work that was done in the 70s, in the late 60s, the 70s, the 80s, the 90s, and then finally, we got patient protections in 2009, 2010, excuse me. So it is a long game approach, but I think looking back at history, it always encourages me. I always look back, I think about those who had bigger hurdles to get over. And I know that the hurdle that I have to get to, I have the energy, and I have the dedication, and I have the commitment. And so I just get inspired by those people who came before me. And I also know that eventually it will happen. It's like, it sounds crazy to think like you should just have blind hope, but um, it's the only thing that's going to get you through when it comes to things that you're passionate about, is believing in yourself and believing in Congress, which sounds crazy to do, but I do believe that these human beings will do the right thing. You just have to remind them why it's important, who it's going to help, and how it's going to not just benefit us as patients, but benefit them as well, because at some point, everybody's a patient.
That's absolutely true. And I will say, I think almost 100% of the time when I'm either in the office or I'm on a phone call with staff members, they will have questions about the disease state. And we're usually there talking about the inflammatory bowel diseases or other digestive conditions. But they will almost always have a personal story themselves. So, they're a patient, or they know someone who lives with IBD, or they had a roommate who. So when they share those things with me, that's also something that I kind of lean into, and ask them a little bit more about, well, how are they experiencing things? Do they live in the same state that I live in, or what, do they live somewhere else, and how are things different? And it's a way to connect and to understand, and for us all to get a broader understanding of how these policies impact all of us across the country and the things that we need to do to make it better for everyone. I don't think I've ever met with a staff member who was a little bit like, oh, I don't think we need to do that. It's almost always like, yeah, wow, this is, this doesn't seem right. So, let's move forward and I want to take this to my boss, and here's the things that my boss are interested in, and how we can relate that, and how we can move forward with that. And then also, I think you mentioned, Brooke, like taking notes when you're in these meetings. And that's one of those things, when you follow up with that staff member, if it's the health policy expert. And I've met with health policy experts who are MDs, who are PhDs, and sometimes they understand things in a slightly different way, or who are patients living with chronic illness themselves, and they understand things in a different way. And then, when I write back to them, I'll say, I'll reference our conversation, and building those relationships has been impactful, I think, from an advocacy perspective, and also just personally fulfilling, to be honest. I mean, the last thing that you and I did before lockdown was go to DC.
Literally being chased out of DC by COVID. Literally, guys, like, I think we left and then the world shut down. Right?
Absolutely.
It was like the next day.
It was literally the next day. Was on the train ride home. And this is one of those little things that we sort of got kind of a heads up,
we got a serious heads up. Like, before you walk out the door, just wanted to let you know, friend.
Yeah. So, personally, we got, the connections there were helpful in that respect. I remember I was texting everyone I knew on the way home, get some groceries. And,
it's interesting. I know that it feels overwhelming as advocates, as patients. There's just so much we have to do. But this is, I want you to think about it as just another thing that needs to be done. Just another thing on the list. Don't think of this as something so huge. You're telling your story. You tell your story to your doctors. You tell your stories to the class mom about volunteering. You tell your story to your friends. You tell your story all the time. This one you just want to perfect and get, under 2 minutes and be able to just roll it off. And this time, you telling your story this one time is going to be way more impactful than you explaining it to the PTA mom. This one is going to help more people than you know. So telling your story matters more than anything. It matters. And I know it gets exhausting, but I really wanted to emphasize that, because it feels intimidating when we start talking about politics and governing and policy and all the, when you open a bill and you look at the summary, they're all like these words and you're like, this is a lot of words. Why are there so many words? But there are people here all over that can help you figure out what are the parts that work for you in that piece of legislation and what parts don't. And they're going to be different for everyone. So you have to be honest, and you have to know how to relate your story to the piece of policy, and you can do that better than you think you can. I promise you.
Absolutely, totally. And I think that it has helped me find some purpose, because sometimes it feels as though things are random, and you ask, why do these things happen to me, and why am I living with this illness? But you can make a difference in the lives of everyone living with a chronic illness, who, in advocating for these things. So I think that's been something that's been impactful for me.
Absolutely. Thank you so much for coming to our talk. We hope that you get in contact with us. If you have any questions, if you want to tell your story, if you want to share your story, we are here, and you can visit us at ibdmoms.org. You can always email us at ibdmoms@gmail.com. And I hope that this inspired you to come to the Hill and visit us, and hopefully we'll see you sometime there. Of course, for IBD Moms, I'm Brooke Abbott.
I'm Amber Tresca.
And we are hoping that your coffee is stronger than your toddler's tantrums. Goodbye, everybody.